I am Dr. Muralidhar. Today, we'll just know a few details about what is heart attack, which is a very important topic in the recent times, as many people know that it is occurring even in younger patients. We'll discuss about the reasons for such heart attacks in young people. So earlier, heart attacks used to be very common in the elderly, which is again due to the atherosclerosis which happens in the coronary arteries, means the arteries which supply blood to the muscle of the heart, which is otherwise called as myocardium. So let us know how the myocardium is supplied with blood. Now the myocardium gets blood from two arteries, one from the right coronary artery and the other from the left. So when atherosclerosis happens within these small tiny blood vessels, the muscle of the heart will not get any blood. This causes pain, so which we call as angina. And then if the atherosclerosis worsens and the block becomes severe, then the person can have a major heart attack, which is called myocardial infarction, MI. And when this happens, a portion of the heart muscle will cease to work, or sometimes the entire heart's muscle will not work, which we call as the acute coronary syndrome. Why this happens? Because inside the coronary artery, sometimes there is a clotting of blood, which makes the entire blood vessel clogged with clot, and beyond this blood vessel, no blood flows, because of which the heart muscle dies, and then the heart, which is pumping the blood into the nook and corner of the body, will stop pumping blood. So this causes a major heart attack, and sometimes this can be fatal and the person can die because of this. So what are the reasons for these normal heart attacks? The reason being age. The next thing would be the rapid atherosclerosis which happens in the diabetic patients, because we know that in diabetes the atherosclerosis progresses faster. The other causes being elevated cholesterol or triglycerides or smoking, which sometimes more than one factor will cause heart problems. So one need to be very careful in all these areas and to take care of his own heart. When the person gets heart attack, the pain in the chest is so severe, it is almost comparable to the labor pain. But unfortunately in diabetics, because of the problem with the heart nerves, the pain may not occur. So we call that as silent heart attack, which is quite dangerous, as patient will not come to the hospital with pain. So there is sudden death due to cardiac arrest in such cases. So what happens in acute coronary syndrome? I have told you there is a sudden clotting of blood, and we should know the common tests which we do for these heart attack patients, which everybody knows is the ECG or the resting ECG, which is quite commonly done, and many times it also gives an indication of heart attack. But when the patient is stable, young, and is able to walk and run, we do a test called treadmill ECG. Means the patient is asked to walk on the treadmill, and we connect ECG and know the changes which happen during walking. Then the other routine tests like the echocardiogram, and the ultimate test being the coronary angiogram, which exactly tells what is happening within the blood vessels of the heart. And once these tests are done, we can diagnose which artery of the heart is blocked and what can be done. Sometimes there are more than one area of the coronary artery which is blocked. So we call a single vessel disease, a double vessel disease, a triple vessel disease. Many times 5 places the vessel is blocked. So in which case the patient has to undergo a surgery. 1, 2 or 3 places blocks can be tackled with angioplasty, that is called balloon angioplasty. We can put a balloon inside open it up and open the vessel and keep it open by replacing a stent there. So this is stenting. So there are many times when the stent won't work, and at such situations a patient has to undergo a bypass surgery, which is a major surgery. Earlier we used to do these bypass surgeries by stopping the heart, which was very invasive, and now we have found methods of doing this bypass surgery even when the heart is pumping, when the heart is beating. So we call it as beating heart surgery. So they have become very simpler, and now even the approach has become very simple. When earlier we used to open the entire chest and do the surgery, now we do mini thoracotomy. Only a small portion of the chest is opened and then the bypass is done. And many people have even tried putting a scope into the thorax, and then using that we can do a bypass. So the procedures have come down, and then they have become minimally invasive. That is very important. However, now I was telling you about the heart attacks in younger people. Now you know there are a lot of younger people who are stressed due to the work pressure, maybe due to a lot of other reasons, domestic reasons. So they are stressed out, and the stress is one important factor for heart attacks. Associated with this, there are features like early diabetes. We are seeing diabetes in very early ages. That may be the reason for increased heart attacks in younger people. So there are professionals like software engineers who are sitting for a long time without any exercise, without walking, and they are putting on weight. Obesity, long hours of sedentary life will definitely lead to heart attack. Now you may ask me, what are the points for prevention of heart attacks? The prevention can be done by keeping a check on the body weight. One should not become obese, and one should not have a sedentary life. He should be active, doing exercises, and keeping oneself fit is very important for so many diseases. So in a way, even the heart attacks can be prevented by keeping oneself fit. So that is most important. Monitoring of blood sugars and keeping the glycosylated hemoglobin less than 6.5 is very important. The levels of cholesterol, levels of triglycerides are also very important, because they are the ones which will get deposited within the blood vessels of the heart. So if you keep the levels of cholesterol and triglyceride in a normal range, the development of blocks within the heart arteries is minimized. So these are all very important factors. If someone is a smoker, of course he has to stop smoking. Then his atherosclerotic progression will definitely be minimized. And many times the smoking causes tendency to clot. The blood of the smokers is always thick, and it is called hypercoagulable blood. So that has to be reduced, and the stoppage of smoking will definitely help in preventing heart attacks. As we were discussing, the heart attack causes damage to the heart muscle. When a large portion of the heart muscle gets damaged, a person can go into a condition called heart failure. When the heart fails, it will not pump blood. So the person will have a low BP, and the low BP can be so severe, or sometimes it can be very low, or the heart can suddenly stop, which we call as a heart cardiac arrest. So sometimes there are certain simple tests like finding out an enzyme called troponin in the blood, which has become very popular in the recent times, because this enzyme is present only in the myocardium, that is only in the heart muscle. When there is damage of the heart muscle, this enzyme enters the blood. So because it enters the blood and we know that it is entering the blood, we can do estimation of this enzyme using simple tests like CAR test. And with this, if you find out there are increased levels of troponin in the blood, when there is damage to the heart muscle, there is an enzyme called troponin which enters the blood. Now that we know, by estimating the level of troponin in the blood, we can know what is the damage of myocardium. And also, if after some time you estimate troponin which increases in levels, we are very sure that there is more damage to the heart. So these simple tests are very useful, and one should know that such tests are existing, are available, and we can do it even as a card test to estimate troponin to find out there is damage to the myocardium or not.